So DBT stands for Dialectical Behavior Therapy, and a lot of people get referred to us specifically to go through this program. It's a program that is designed to teach life skills, and these are skills that we don't learn growing up. They're skills to learn what to do when you're in an emotional crisis and you literally can't think anymore, when you're trying to have hard conversations and you can't set or hold boundaries, or you blow up at the other person, when you don't understand what you're feeling. You know something is wrong, but you don't really know what it is. So understanding those emotions and learning what to do with them. What happens with people, and the reason that they come into DBT, is that the emotions are really big. I think of it as the emotions are driving the bus. And you start to have consequences, behaviors that get you into trouble. And so people that show up for DBT have gotten to a place where life is not manageable anymore. And it's because the emotions get in the way. The groups are 2 hours once a week, and it's run by 2 therapists. Every group is run by 2 therapists. We have a maximum of 8 people per group. In the first half of the group, we review homework practice, how people practice the skills from the previous week. And in the second half, we teach new information. And DBT is not a spectator sport. DBT is full participation. And that means that we encourage people to share their homework, to come out and talk about their experiences, and we do it in a really safe way. We don't want to do what's called getting into the rapids. We don't want people to trigger themselves or other people. So we keep it at sort of a light level. How do we use the skills? What was it that set us off? And then how did we address it? Instead of going deep into the story. Now, when you're in the DBT program, you do have to be in individual therapy. And the reason is we know that you need to work on the story. And you work on the story and the deeper stuff in individual, and then you work on the skills in the group. So when you come in, we measure where you're at, and when you finish, we measure where you're at. And on average, people will see their symptoms decrease by 50%, but we've seen it up to as high as a 90% reduction in symptoms. So if you're not sure about DBT, I encourage you to give me a call. We do free phone consultations. Happy to chat with you more about it. You can also read more on the DBT web pages within our website.